I have a patient I want to tell you about. He is 102 years old. He still drives himself to his own medical appointments. He tends a small vegetable garden every morning before breakfast. He has not been admitted to a hospital in over 30 years. And when I asked him recently what medications he takes, he looked at me with a kind of calm amusement and said, "None. I never really got started on them. Now I have been practicing medicine for a long time. I have seen patients on 12, 14, 16 medications at once. I have watched people get sicker managing their side effects than they were from their original condition. And I have spent years asking a question that most physicians never get around to asking. Why are certain people simply not deteriorating the way we expect them to?" Loma Linda. So California is one of the most studied communities on Earth. It has been documented by National Geographic, by the National Institutes of Health, by longevity researchers from Harvard and Oxford. The people here live on average 10 years longer than the rest of America. There are physicians in this community who are still in active practice in their 80s. There are people here in their 90s doing things that 40-year-olds in other cities cannot do. And after decades of living and practicing medicine inside this community, I can tell you with complete confidence, it is not genetics, it is not luck, it is not some rare supplement or expensive treatment. It is a set of daily practices so simple and so consistent that most people, when they hear them, feel almost disappointed. Because the human mind wants the answer to be complicated. It wants a pill. It wants a procedure. It wants something it has to pay for. What the oldest, healthiest people in Loma Linda do instead is almost embarrassingly ordinary. And today, I am going to walk you through exactly what it is. If this is the kind of conversation you want more of, honest, evidence-based, no product to sell you, subscribe to this channel and like this video. It genuinely helps more people find their way here. Before we get into the practices themselves, I want to explain something about how disease actually begins, because most people have a fundamentally incorrect picture of it. We tend to think of illness as something that happens to us. A diagnosis lands like an event. You were fine, and then suddenly you had high blood pressure, or type 2 diabetes, or early-stage coronary artery disease. But that is not how any of it works. These conditions take 15, 20, sometimes 30 years to develop. They are the slow accumulation of thousands of small decisions that either feed inflammation or reduce it, that either damage the endothelium, the delicate inner lining of your blood vessels, or protect it. The single most important biological concept for understanding why some people age and others don't is chronic low-grade inflammation, not the acute inflammation of a cut or an infection, which is healthy and necessary. I am talking about a permanent, smoldering, low-level inflammatory state that damages tissue continuously over decades. Every major disease of aging, cardiovascular disease, type 2 diabetes, Alzheimer's, most cancers, has chronic inflammation as either a cause or a powerful accelerant. And here is what the research from Loma Linda and from the broader field of longevity science tells us. The practices that the longest-lived people follow are, almost without exception, powerful anti-inflammatory interventions. Not because they were designed that way, but because the human body evolved in conditions that these practices recreate. The first practice, and in many ways the most foundational one, is what they eat. Not a diet, a pattern. The majority of the longest-lived residents of Loma Linda follow a predominantly plant-based way of eating. Not necessarily fully vegan, but oriented entirely around whole, unprocessed plant foods, vegetables, fruits, legumes, whole grains, nuts, and seeds. Studies published in the journal JAMA Internal Medicine found that vegetarians in the Loma Linda community had significantly lower rates of hypertension, diabetes, and metabolic syndrome compared to non-vegetarians within the same community. But the specific element that stands out in the research is legumes, beans, lentils, chickpeas. These appear in the diets of long-lived populations across every longevity hotspot on Earth, not just Loma Linda, but Sardinia, Okinawa, Nicoya in Costa Rica, and Ikaria in Greece. A half cup of cooked legumes per day is associated in multiple large-scale studies with a measurable reduction in all-cause mortality. The mechanism is not mysterious. Legumes feed the gut microbiome in a way that reduces systemic inflammation. They stabilize blood glucose. They provide a form of protein that does not carry the inflammatory load of processed meat. They are high in polyphenols that protect the vascular endothelium. The physicians and community elders I have spoken with here do not count macros. They do not track calories. They simply eat, as one 94-year-old colleague of mine puts it, food that still looks like what it was. If it came out of a factory with a 12-ingredient label, it does not make it onto the plate. The second practice is one that modern medicine has only recently begun to take seriously, despite the evidence being overwhelming for decades. It is walking, not high-intensity interval training, not competitive cycling, not anything that requires a membership or special equipment. Walking, specifically the kind of low-intensity, though sustained physical movement that was simply called daily life for most of human history. The Adventist Health Studies, the largest ongoing study of Loma Linda's population, found that individuals who engaged in regular moderate physical activity, including walking, had significantly lower rates of cardiovascular disease and lived substantially longer than those who were sedentary, even after controlling for diet and other lifestyle factors. What is happening physiologically during a daily walk is remarkable. Skeletal muscle contraction releases anti-inflammatory molecules called myokines. Blood flow increases through the capillary beds. Insulin sensitivity improves. Cortisol, the primary stress hormone, decreases. Brain-derived neurotrophic factor, the protein responsible for the growth and maintenance of neurons, rises. Researchers at the University of California, San Francisco, found that older adults who walked regularly had measurably slower rates of cognitive decline. The elders in this community walk as a matter of course, to the store, to visit neighbors, after dinner, before breakfast. There is no performance to it. 101-year-old physician I know here told me he walks every single day of his life because, as he said, "The day I stop moving is the day my body gets the wrong message." And that is not poetry. That is biology. The human body requires movement the way it requires water. Prolonged sedentary behavior is, according to a growing body of research, an independent risk factor for mortality, separate from whether someone exercises or not. You can go to the gym 3 times a week and still be at elevated cardiovascular risk if you sit for 9 hours a day. The solution is simple. Move consistently throughout the day, not intensely, just consistently. If you are still here and finding value in this, take a moment to subscribe and like this video. This channel exists to bring you exactly this kind of conversation, honest, researched, and free. The third practice is one that carries a stigma in productivity-obsessed cultures, which is precisely why it is so consistently ignored. It is rest. Specifically, the deliberate, non-negotiable practice of stopping. The Loma Linda community observes a weekly Sabbath, 24 hours from sundown Friday to sundown Saturday, during which work stops, screens are put down, and time is spent in nature, in community, and in quiet. Now, regardless of your religious background or beliefs, the physiological data on what this kind of structured rest does to the human body is profound. Research published in the journal Psychosomatic Medicine found that chronic work stress and the inability to psychologically detach from work were independently associated with elevated inflammatory markers, including interleukin-6 and C-reactive protein. the same markers elevated in cardiovascular disease and accelerated aging. Cortisol dysregulation, what happens when the stress response is never fully switched off, damages the hippocampus, impairs immune function, disrupts insulin signaling, and accelerates telomere shortening. Telomeres are the protective caps on your chromosomes. When they shorten, cells age and lose their ability to replicate accurately. Chronic stress accelerates this process measurably. The practice of a full day of rest is not a religious indulgence. It is a biological reset. The body's repair systems, cellular autophagy, immune surveillance, tissue regeneration, operate most efficiently during periods of genuine rest, not merely sleep, but the absence of sustained cognitive and emotional demand. The elders here are not relaxed because they are old and have nothing to worry about. They are old, in part, because they have been genuinely relaxing, deliberately and regularly, for decades. The fourth practice is the one that is perhaps the hardest to prescribe and the easiest to dismiss, which is why I want to spend real time on it. It is social connection. Deep, committed, reciprocal human relationships. The research here is stark. A meta-analysis published in PLOS Medicine that analyzed data from over 300,000 individuals found that social isolation carried a mortality risk comparable to smoking 15 cigarettes per day. Loneliness is not a mood. It is a biological state that triggers the same neural and hormonal pathways as physical threat, elevating cortisol, increasing vascular inflammation, impairing immune function, and disrupting sleep architecture. In Loma Linda, community is not optional, and it is not accidental. The social structures here, the faith communities, the small groups, what locals call moais, create a dense web of mutual accountability, shared meals, and daily contact across generations. Older residents are not isolated in separate communities. They are embedded in active social networks where their presence is expected and their absence is noticed. One researcher at Brigham Young University described social connection as the single most powerful predictor of longevity that exists in the data. More powerful than diet, more powerful than exercise, more powerful than not smoking. The mechanism appears to involve the oxytocin system, the regulation of the hypothalamic pituitary adrenal axis, and the direct anti-inflammatory effects of positive social engagement. The practical implication of this is not complicated. It does not require moving to Loma Linda. It requires investing in relationships with the same seriousness with which people invest in their nutrition or their fitness. It means showing up. It means having people in your life who expect to hear from you and notice when they do not. The fifth practice is the one that surprised me most in my own research and clinical observation. It is a sense of purpose, a reason to get up in the morning that exists outside of yourself. In the Loma Linda Blue Zone research, one of the strongest predictors of longevity was what researchers called plan de vida, a Spanish phrase roughly translating to life plan or life purpose. Individuals who were able to clearly articulate why their life mattered, who depended on them, what they were still contributing to, these individuals outlived those without such clarity by a statistically significant margin. The biology here is increasingly well understood. Purpose regulates the default mode network in the brain, reducing rumination and the chronic low-level anxiety that generates inflammatory cortisol. It predicts sleep quality. It predicts the likelihood of maintaining health behaviors. A study from Rush University Medical Center found that having a strong sense of purpose was associated with a 52% lower risk of Alzheimer's disease. Every physician and elder I have spoken to here who is still vital and cognitively sharp in their 80s, 90s, and beyond, every single one of them has something they are working toward, a garden they are tending, A grandchild they are mentoring. A community project they are responsible for. A student they are teaching. Purpose is not something that arrives naturally with age. In many cultures, it is stripped away at retirement, when social role disappears overnight. The longest-lived people I know have never allowed that to happen to them. We are nearly at the end of this conversation, and I want to take a moment to step back. Because you may be listening to these 5 practices: plant-centered eating, daily walking, structured rest, deep social connection, and active purpose, and thinking, I already knew this. And perhaps you did in some form. But knowing is not the same as doing, and doing occasionally is not the same as doing consistently, for decades, as a non-negotiable feature of daily life. This is the actual secret of Loma Linda. It is not any single practice. It is the compound effect of all of them, maintained without interruption across a lifetime. There is no dramatic intervention. There is no pharmaceutical shortcut. There is only the quiet or daily accumulation of choices that the body knows exactly what to do with. I want to be clear about something as a physician. None of what I have described today is a substitute for proper medical care. If you have a diagnosed condition, if you are on medications prescribed by your doctor, please do not make changes without professional guidance. What I am describing is not an alternative to medicine. It is what the evidence suggests medicine should have been built around from the beginning, and what the healthiest, longest-lived populations on Earth have always practiced. If this is the kind of content you want more of, subscribe to this channel and like this video. And make sure to activate the notification bell so you never miss a conversation like this one. The oldest active physician in the Loma Linda community, when asked what single piece of advice he would give to someone who wanted to live well into old age, said something I have thought about every day since. He said, "Stop waiting to feel like it. The body does not feel like doing the things that keep it alive. It has to be shown every morning that you have decided to live." That is not a medical protocol, but it is, I believe, the deepest truth in all of medicine. Take care of yourselves. We will see you in the next conversation.